I recommend having your patient scoot closer to you because otherwise this gets very tiring very fast. All right, so your first image should be transverse isthmus. Not towards me, just like ultrasound works. Oh, I was right. You do have a pretty thyroid.
Oh my gosh. I'm so over it, Michelle.
Hey, at least
Okay.
you get to scan me.
So a couple
That's
of
true.
landmarky things. Let me just talk really quick.
I know, just like the PowerPoint.
All right, yeah, she is exactly like the PowerPoint. So here we have our longest coli muscles, esophagus, bilateral common carotids. You can really see the IJ on this side, see it like pulsating and kind of collapsing under the weight of my smushing it. Right and left lobes of the thyroid. This is your trachea. And then your strap muscles kind of coming around anteriorly.
So cool.
Okay? Oh yeah, and then this is the isthmus. So, turn that off. For your first image, let's get us a nice, we want nice even grays from top to bottom. Okay? That's how you know that your gain is good. Alright? Oh, I have to click comment. Transverse isthmus. What you want to see here is that your right and left lobes are on the screen relatively the same size. I'm seeing now that my left one might be a little small. So remember how I said you could make one side a lot smaller than the other by twisting? So see how this side is a lot bigger than this side?
Mm-hmm.
So I'm just kind of bringing that far side up to make them a little more comparable. They're not necessarily perfectly the same size, but they are considerably closer now than they were. You want to see that isthmus wrapping over the top, connecting fully from right to left. And generally you want to see that your isthmus is going to be the same width all the way across. Okay? So that's your first image. And then you're going to measure. You measure the isthmus anterior to posterior and in like the middle-ish area. So I'm going to start at the upper border and go to the bottom one. So this echogenic line here, see that? Is the first portion of the trachea. So I'm not going to include the trachea in my isthmus measurement. I tell students to watch your textures. That's generally an easier way to kind of help you differentiate. If we look at it, why aren't you? Scoot the zoomy. It won't let me scoot the zoomy. So we see how like this texture is not the same as the isthmus texture right above it. So if you keep an eye on your textures, sometimes that helps kind of pick out that thyroid tissue, okay? So then your next picture, that's not what I wanted. Let's do right, thyroid, transverse, superior. So what I'm gonna do is I'm literally going to take my probe, slide it to her right side. I have my right thyroid in the middle of my screen, yes? Something that I like to tell students is make sure that we're going all the way up. We've left thyroid land. Okay, there's no thyroid on the screen. And I'm going to come back a little bit until I start to see a little bit of thyroid tissue here. That's how we know that we are superior. Your superior shot may be, I like that depth better, somewhat triangular depending on the shape of the person's thyroid, or it might be a little bit rounder. Again, just kind of depending on the shape of the person's thyroid. You don't want like barely any tissue. See how we have like just this bit? We want a little bit more, like you want to be able to see it. Does that make sense? We want to see the thyroid. So if you go all the way out and come back a little bit until you can see like a nice amount, there's your superior. Okay? And then we do mid. So I'm going to come down just a little bit further, kind of to where that isthmus starts to shoot off. We see the isthmus coming off here?
Mm-hmm.
So this is my middle thyroid. You can kind of scan through a little bit just to see if it gets like wider at a certain point and use that. Again, you're wanting it in the middle of the screen. Mid. And then you're going to measure. It doesn't really matter which way you start, it's just that you're measuring straight across, okay? So you're not wanting to include isthmus in your measurement. See how this would include like part of the isthmus? I'm wanting just the widest point of the lobe itself. Yes?
Mm-hmm.
And note that our width, as discussed, is usually between like 1 and 3 centimeters, which it is. And then you're going to go inferior. So you're just going to scan all the way down till you run out of thyroid. Come back a little bit. There's your inferior, which is not in the middle of the screen. There we go. Your inferior might have a small amount of isthmus kind of coming off of it. This is because the thyroid is a kind of butterfly-shaped gland that goes like this, and the isthmus kind of connects towards that lower pole. Depending on how pointy that lower pole is, you may have no isthmus, or you might have a very small amount of isthmus. So like by coming down, I'm still seeing that bridge of isthmus tissue that kind of wraps and connects the two. That is perfectly okay. You may see it, you may not see it. It just kind of depends on the person, okay? I really hate the phrasing supposed to look like. Everybody is different. There is no supposed to look like, okay? It's whatever you see. That is what it is for that person. As long as you've scanned all the way out and come back, that's whatever your inferior is. That's what it looks like on that person, okay? So here we're looking at like this little strip here, and we do have a tiny bit of isthmus kind of poking up there, okay? Your difference between your mid and inferior pictures is how big it is. Look at this. This is massive. See what I'm saying? This is huge. This is not huge. Yeah? Kind of, sort of, maybe? All right. So then we're going to go sagittal. We're going to start with medial. So this is large enough. We can do virtual convex. So virtual convex is a neat little tool that allows you to have a little bit more imaging. You'll note that it turned my sector into like a, what shape is that?
Trapezoid.
Thank you. Trapezoid. I know my shapes, guys.
We passed physics.
So your virtual convex on these machines is number 1 of your like whatever key that is. If you click it, it like kind of zooms out a little bit and gives you this trapezoid shape that just lets you see a little bit more tissue. This may be necessary in patients that have longer thyroids, okay? So this is my thyroid tissue. I'm going to angle medially, so towards the trachea. I'm going to go all the way until I run out of thyroid. This is my trachea here. And then I'm going to come back a little bit until I start to see, a lot of times it looks like a little boat of thyroid tissue. This is my little boat of thyroid. This is one of the vessels of the thyroid, and we do see a little bit of trachea here. You'll note that this is in the middle of the screen, and it is straight. These wonky things are really quite irritating. Okay, there's my medial. And here's what my crooked, of course, making crooked on her is hard. That's annoying. Here's a crooked thyroid. Also, loss of contact is super irritating. Don't lose contact. So I've gone all the way medial. I'm coming back now to mid. So mid is just like wherever it's biggest. Now recall that the thyroid sits kind of at an angle, so you might have to oblique your probe a little bit to get the full length of the thyroid. That's okay. We're just looking for the longest piece of it. So I'm gonna kind of like fan around a little bit, see where I find like the largest stretch of it. Your movements are gonna be based on your person, not necessarily like a set perfect, every time I do this, it works. I like that. That's pretty cool, I guess. So we are still straight across the screen, still centered on the screen. This is our mid that I can't spell. Okay. You will measure length. You're starting at one end, going to the next, and AP. Again, following your textures here is good. I know thyroids are kind of hard to see for a lot of students. Just practice. I promise it'll come to you. And then you're going to angle laterally. What structures do we normally see laterally?
Carotid.
So I'm going to go till I see the carotid. Then I'm going to come back until I see thyroid. Here is a little bit of thyroid. That's not straight. There we go. Here's a little strip. of lateral thyroid. Okay? Some patients, you may see the carotid coming underneath it. Sometimes you will not. It's cool if you can get it, but it's not required. The important part is that you've gone all the way out and come back a little bit to get your lateral thyroid image. Okay? And then it's exactly the same thing on the left. Do we want to go through the left? We technically only have 5 minutes. It literally looks exactly the same. Superior, mid, inferior. I like that better. Here is our sagittal. Dang, she's so pretty. So there's my trachea coming back. There's my little bit, like a little gravy boat of thyroid. Here's my mid. You can see this nice chunky. Oh, and you can see esophagus a little bit there too. And then lateral, going all the way out, coming back a little bit. Here's my little strip of lateral thyroid tissue. Questions, comments, concerns?